Greetings. Welcome to another video of surgical discussion. In this video, we will be discussing about kinematics. Kinematics is a branch of physics that deals with pure motion. There is no reference whatsoever to the mass or the force of the object. Now one can imagine that all injuries occur due to reactions between the victim and the object, both of whom could either be in a state of motion or rest. The object could be very large, like a car, a bullet, a heat particle, but whatever it is, in the end, there is going to be a reaction between the object and the victim, and this will tell you what really happens to the victim and how his organs can react. To further understand the reaction between the victim and the object, it is necessary to briefly look upon Newton's laws of motion. The first law is basically about inertia, which says that every object will remain in rest or in motion unless it is compelled to change its state by the action of an external force. Meaning that, let's imagine you keep driving a car and you're wearing a seatbelt. Both you and the car are in a state of motion. And when you brake, the car brakes. The car stops, so does your car seat. But because you were in a state of motion and you were suddenly stopped by an external agency, your body tends to move forward. The same thing can even happen when you suddenly brake the car and your body tends to move backwards into the seat. The second law deals with the force, which says that a force is equal to the product of the mass and acceleration, which means that to apply more force, either the mass should be great or the acceleration should be great. When you say acceleration, it means the change of velocity. For example, a bullet is very small in size, it has a very low mass, but it increases its speed every second. Therefore, it can have a destructive force. On the other hand, a hammer is very heavy, but the acceleration that you give it is not as much as a bullet, but it can cause considerable damage because of the mass. The application of force occurs over time. Therefore, force into time, that's the impulse, is also equal to the force into time, that is mass into velocity, also known as the momentum. Thus, the force or the impulse or the momentum can cause more damage when the rate of change of momentum is quick. So one should understand that if the very heavy object goes at very high speeds, there is a lot of damage, or a very small object going at rapid speeds can do the same. The third law says that for every action or force, there is an equal and opposite reaction. And this will become more evident when we start dealing with kinematics in relation to the human body. As all of you are well aware, matter and energy cannot be created nor be destroyed. Now you have understood that force is the mass of an object into its acceleration, whereas the work that is done is the force that was applied into the time that it was applied. Could be seconds or minutes. Now if a moving object slows down while hitting a stationary object, let's imagine that somebody is driving a car and he crashes into a wall. The velocity of the moving object suddenly becomes zero. Therefore, the work which was done was the force of the car into the time has all been transferred into the stationary object. So all that force has now gone into the wall. Don't forget, it even gets transmitted to the car and also the driver inside. And when two objects hit each other, they become nearly stationary. Thus the velocity is equal to zero. In the end, the momentum is equal and thus it's conserved. But all this extra energy has been absorbed by either the wall, the car, or unfortunately the victim, the human being who is driving the car. So this tells you that in a car crash, or in any case of trauma, whether it's inflicted by a hammer or by a machine, in the end, when everything becomes absolutely still and stable, quite a bit of damage has been done to the body tissues. Using that theory as a background, when we compare car collisions, the frontal collision is the worst case scenario when two cars are traveling towards each other and they strike each other, because the work that is done is used in deforming not only the metal but also the humans. A T-bone collision occurs when it's an end-to-side collision. After the collision, both cars move in a certain path. Therefore, the kinetic energy is used to move the cars, and there is lesser work done to deform the metal and the humans. The best case scenario happens to be a rear-end collision. Both the cars move in the same direction, and thus the kinetic energy promotes the movement in the same direction, and there is lesser work to deform the metal and the humans. We can take these same principles for the work done regarding ballistics or bullets. The bullets, they have various effects on the tissues. First of all is the penetration. That means the more distance the bullet travels in the tissues, the more energy it will dissipate inside it. Therefore, if a bullet has an entry and exit wound, lesser amount of force has been transmitted into the body because the bullet is exited. Next is fragmentation, wherein the bullet has been designed to break into fine bits. Therefore, it damages not only the target site but also areas around it. During the fragmentation process, the small bits can actually get into the tissues and they get stuck there because of the next phenomenon of cavitation. So these could do considerable damage to quite a large area of tissue. The next phenomenon is cavitation, which could be either temporary or permanent. Now you can try this, that when you just gently tap the body tissues, they tend to shake, they tend to vibrate. When you take a rod and you hit a piece of cloth or a mattress, you can see the shock waves travel away from the site of injury. Similarly, when a bullet strikes the body tissues, it strikes the body tissues usually at supersonic speeds. At the same time, there is going to be a three-dimensional wave away from the bullet. Now this causes the tissues to be stretched. At times, if there is a permanent stretching, the tissues get devitalized. Whereas in a temporary cavity, the tissue is stretched and not necessarily devitalized. So these four mechanisms transmit their energy into the body tissues and cause damage. Now, not necessarily that we are discussing only bullets. The same phenomenon can even occur with other particles. Bullets are designed to be aerodynamic so that they travel faster, but they cause minimal damage to the tissues unless they are constructed to cause more damage. There are certain other movements that cause damage, such as yawing and tumbling. Yaw and tumble basically means the bullet is not traveling in a straight line, but it keeps spinning. If the backside of the bullet is spinning, that's called a yaw. Whereas the bullet is spinning in its own axis, it's called a tumble. Therefore, when the damage occurs, it's not because of the point of the bullet, but the side of the bullet that strikes the tissues. The next thing is deformation. The bullet which is shaped ideally as a bullet becomes a mushroom. Therefore, more surface area, more deceleration, and more damage to the tissues. This diagram on the left and the graph on the right try to represent what happens in a blast injury and also during ionizing radiation, had the blast been due to an atom bomb. Although I just hope these kind of things never happen. During the blast injury, there is a sudden increase in the pressure as shown by the graph. From 0 is a rapid peak over pressure. This pressure, it moves three-dimensionally as shown in the diagram, and the blast wave keeps going from the center to the periphery. At one point of time, there is a negative deflection of the pressure. So there is a vacuum and everything gets sucked back into the center. So if one were to observe what happens in the blast wave, something in the periphery will be thrown away and then thrown towards the center of the blast wave. And this is how the blast causes the damage. Thus, as we discussed, the peak over pressure that is created by the blast wave occurs because either the solid or liquid explosive becomes a gas, and these air molecules possess a lot of density, velocity and temperature. This acceleration happens in milliseconds, and this creates a positive wave. The negative phase creates a vacuum. When it comes to ionizing radiation, the positive wave lasts for seconds and the radiation does the cellular damage. So the radioactive particles will impart damage till they undergo radioactive delay. Thus there is a threefold damage: the positive wave, the negative wave and the radioactive decay. Hopkinson's law states that the distance travelled by the blast wave raised to the power of 3 is equal to the constant into the weight of the explosive. Thus, the heavier the explosive, more the distance will be its travel of the wave pressure. The damage that is done to the tissues depend upon the properties of the particular biomaterial. Stress is the force that is put upon a unit area. For example, somebody throws a punch, and the force that is transmitted per unit area of the tissue is stress. Whereas strain is the deformation caused by the stress per unit of length of material. That means to say each and every tissue, for example bone, muscle, fascia, the amount of deformation it has undergone, that is strain. So a punch to the abdomen or the chest can actually push somebody away and can cause blunt trauma, but the strain put on the ribs can actually fracture them. So that is how do you understand stress and strain. The next thing is the bulk modulus or the Young's modulus, which means that if you take air and try to compress it, the air gets compressed. But try to do the same thing with water and you will not be able to compress it, and that is bulk modulus or Young's modulus. So certain tissues are incompressible whereas certain tissues are. The different strains that can be applied upon the body tissues have been diagrammatically represented. Tensile strain occurs when opposite force stretch along the same axis. Shear strain occurs when opposite forces compress or stretch the tissue in opposite directions but not along the same axis. To understand tensile strain, it is when too much of pull is put on the body tissues. Shear strain occurs in a vertical shear fracture of the pelvis, as an example. Compressive strain occurs when there is usually a simple deformation occurring to the tissues without much of damage. Overpressure occurs when the same compressive force increases the pressure. Thus, at a certain point, there is a breaking point of the wall and the tissues get damaged. For example, injuries of the liver, injuries of the spleen, and solid organs. All materials, including tissues, undergo three phases when any force is applied to them. The elastic phase, when the material restores itself more precisely to the original configuration. If more force is applied at the elastic phase, it goes into the plastic phase, where the stress causes permanent damage. If the force isn't stopped, there is a point where there is a failure or a fracture or tearing of tissues. Air-containing cavities are worst affected by blast waves. That's because they transmit the energy of the blast pretty well. For example, lung and bowel are most affected during a blast. Using those principles, let us move on to blunt trauma, the mechanisms and patterns of injury. Head-on collisions result in mortality of 60% of the victims. A side impact collision like a T-bone may be 20 to 35%. Rollover injuries, surprisingly, are 8 to 15%, whereas rear end collisions is the least, as we discussed earlier, 3 to 5% of mortality. During the rollover injuries, if the passenger was unrestrained and the windows were kept open, there is a high likelihood of the victim getting ejected. There is a sudden deceleration when they strike immobile objects. And these patients are 4 times more likely to need ICU admission, 5-fold increase in their injury severity score, 3 times more likely to sustain injury to the brain, and 5 times more likely to expire secondary to their injuries. So this tells you that if supposing somebody is involved in a rollover injury and an ejection, they are more serious compared to the other kinds of injuries. During a head-on collision, the victim could either slide down or slide up. When the victim slides down, the knee strikes the dashboard or the seat in front of him, thus causing a posterior dislocation of the hip, injury to the popliteal artery. The chest and abdomen can be injured by hitting the steering wheel. In addition, there could be a splenic or a liver laceration also. The rib fractures or the sternal fracture could cause cardiac contusion, the lungs getting popped causing either pneumo or hemothorax, and proximal thoracic aortic shear, either a full or a partial thickness tear in the aorta. In the likely event that the victim slides up, the head is the first to collide with the windshield. The windshield has a starburst pattern over it. There is a whiplash injury to the neck and similar injuries to the chest and abdomen as it impacts the steering wheel. During a T-bone or a lateral collision, the chest could be injured with fractured ribs, pneumo and hemothorax. The abdomen, depending on the site of injury, could either injure the liver or the spleen and the kidneys. And the femoral head is driven through the acetabulum, therefore causing acetabular and pelvic fractures. Rear end collisions usually end up with whiplash injuries of the cervical cord due to the sudden increase in the acceleration followed by the deceleration. During a PVA or a pedestrian vehicular accident, it is usual for the bumper to strike the legs and knees of the pedestrian, therefore causing a tibia and fibula fracture and or dislocation of the knees. The victim falls either on the hood of the car or on the road or on the curb, therefore fracturing ribs, rupturing the liver and spleen, also causing a pneumo and hemothorax. Not to forget, there is even a brain injury because of the head striking either the hood or the road. When a victim falls, the height could range between 5 and 70 feet. Anything more than that could probably kill him instantaneously. During a fall, more than 76% of patients have fractures. 19 to 22% of them have spinal fractures, and 4 of them develop neurological deficits. 6% of patients have intra-abdominal injuries, needing operations for solid organs, whereas less than 1% of patients have bowel and bladder injuries. Therefore, one can realize that during a fall, the most commonest thing that you will see is a fracture pelvis being one of them. 1 out of every 5 would have spinal fractures, and 4 would have neurological deficits. The brain and the head get injured by either a direct impact causing a compressive strain on the skull leading to a brain contusion, or by an indirect impact on the opposite side, also known as a countercoup injury. The brain is loosely connected in the surrounding cranium. Therefore, any impact or a compressive strain will set the skull and the brain in motion. But remembering the laws of inertia, the brain lags behind. So when the skull comes to rest or even recoils, the brain is still moving along the line of the initial force. It strikes the skull on the opposite side and a compressive strain is generated. Therefore, any impact to the frontal area can cause injury to the occipital area. This explains the countercoup mechanism. The forward acceleration of the brain relative to the skull also creates a tensile strain in the bridging veins, which get lacerated, and this is the cause for a subdural hematoma. So the superficial structures which get injured are explained by these mechanisms. There are many theories to understand how the deep structures get involved. The first one is a shear strain between the layers of the brain. So whenever there is a shear or strain between two perpendicular structures, for example the spinal cord and the brainstem, or different layers of the cerebellum or the cerebrum themselves, this causes an injury to the brain. Second of all, the inner surface of the skull, which looks something like a satellite dish, has a wave propagation phenomenon. So the concavity of the skull acts as a collector, and this focuses multiple wave fronts to a deep focal point. This causes disruption of the tissue, even though there is very minimal tissue injury at the surface. The reticular activating system gets disrupted, and this causes a loss of consciousness. Diffuse axonal injury is a progressive process in which initially there is a focal axonal alteration, finally leading to a disconnection. Now, when there is a traumatically induced focal axo-lamellar permeability, there is an increased influx of calcium into the axon. This releases the proteases that digest the membrane skeleton. And once this happens, this leads to local axonal failure and disconnection. So this explains the deep structure injury and the theories which go around explaining diffuse axonal injury. Maxillofacial injuries are very common after motor vehicle crashes, and the morbidity of the driver and the front seat passenger is more compared to the back seat passenger, because the passenger sitting at the back has many soft headrests and seats to cushion the impact. The mid-face usually gets fractured, similar to a traumatic brain injury, when the occupant impacts the steering wheel, dashboard, or the windshield. And all these injuries are secondary to the compressive strain, which occurs on the skull and the tissues. Considering the thoracic injury, the rate and the degree to which the inward displacement of the body wall occurs results in a compressive strain. So the pattern of injury of the internal organs reflects the interaction between the fixed and the mobile parts. Ribs usually get fractured in the lateral and posterior lateral angles, and during this phase a rapid distortion of an organ can occur. When there is a blunt intrusion into the hemithorax, there is an increased pressure in the fluid containing organs. As you know, fluid is both liquid and gas. Thus there could be pneumothorax, hemothorax, and cardiac rupture. The heart can get compressed to almost half of its pre-crash diameter, with the pressure inside its chambers getting almost doubled. And this explains the mechanism of injuries. The shear and stress at the junction of the fixed and mobile parts of the structures of the mediastinum will now be able to explain the mediastinal vascular injuries and the bronchial injuries. During a horizontal strain, for example, somebody striking the steering wheel, or in a lateral collision, somebody striking the door of the vehicle, the heart is mobile, whereas the aorta is immobile. because it is fixed to the spinal column by the ligamentum arteriosum. Therefore, there is a rupture or transection of the descending thoracic aorta. In a vertical strain such as a fall from the height, the tensile strain occurs at the root of the ascending aorta with the mobile heart. So this tells you the difference between a vertical and horizontal strain. The trachea and the carina are fixed, but the major bronchus is still mobile. Therefore, a shear occurs at the main stem bronchus within 2 centimeters of the carina. This could occur in either vertical or horizontal shear injuries. As shown in this diagram, regarding horizontal deceleration, the initial force could be either the steering wheel hitting the chest or the steering wheel hitting the door. When this happens, there is a reactive force of the heart keeping on moving forward. The junction of the fixed and the mobile portion is the descending thoracic aorta, and that gets either torn or transected. Notice that on the right side, vertical deceleration, the initial force is upwards, whereas the reactive force, because the heart is relatively mobile, is downwards. Now the point of shear happens to be the root of the ascending aorta, and that's what gets torn or sheared in a vertical deceleration injury. The diagrams here represent what happens to the main stem bronchus within 2 centimeters of the carina. In either vertical or horizontal injuries, this is the maximum point of shear strain. As far as the abdominal organs are concerned, it is important to know these points of shear strain: the falciform ligament, hepatic veins, which is the porta, the ligament of Treats, the terminal ileum, the mesentery of the sigmoid colon, the splenic hilum, and also the junction of the neck and the body of the pancreas, because that is where it gets attached to the L spine. So in any case of blunt abdominal trauma, while doing a damage control surgery, one should always look at the junctions of the mobile and the fixed portions, because this is where you can expect maximum injury. The solid abdominal viscera are more vulnerable to injury because of lack of protection by the bony cage. There are two mechanisms of trauma. The first could be a direct compressive strain, which we talked about earlier, when there is overcompression and it tests the limits of the elasticity of the organ, and there could be rupture of the kidney or the liver or the spleen. Second of all, as we just discussed earlier, the shear strain to the point of attachment and the mobile junction. The solid organs are quite heavy, and their ligaments, when they get sheared, could actually be a point of bleeding, and this also leads to further injury of the solid organs. The hollow abdominal viscera can be injured by either overcompressive forces due to overpressure and blowout, or due to shear strains because of the junction of the fixed and mobile portions. The small bowel within 30 centimeters of the ligament of Treats, or the ileocecal valve, or even the mesosigmoid. The theories here support shear force theory. It can also occur that there is some kind of a pseudo obstruction by a temporary closed loop, for example the duodenum, the sigmoid, or even a loop of small bowel. Whenever there is an overpressure, that area will suddenly give way and blow out. Now, considering the whole of the abdominal together, there are solid and hollow organs. So when there is an overpressure to the entire abdominal cavity, on the right side there is the liver, in the center there is the heart, whereas on the left side there is a compliant diaphragm and the lung. And this increases the pressure of the left side of the diaphragm, therefore leading to a left side diaphragmatic injury, which is more common than a right-sided diaphragmatic injury. Injuries to the musculoskeletal system is the most commonest in a blunt injury. The ratio of orthopedic operations done to general surgical, neurosurgical, or chest surgical is usually 5:1. The airbags and seat belts have reduced the incidence of intracranial and abdominal injuries. The musculoskeletal injuries usually need operative repair and rehabilitation, and a significant proportion of these patients have permanent disability. The high energy injuries can involve extensive loss of soft tissue, neurovascular compromise, and highly comminuted fracture patterns, whereas the low energy injuries are associated with crush or avulsion of the soft tissue along with simple fractures. As seen in these pictures, different strains can cause a variety of fractures because there is a pull on one side and push on the other side of the bone. Whenever there is a fracture, most people only look at the x-rays and they think of the bones, but they really tend to forget that these fractures at the same time could cause muscular injuries, facial injuries of the fascia they could be compounded by opening to the outside and get infected. At the same time, they could cause neurovascular injuries. So an orthopedic injury is not simply a fracture, but as just explained before, it could be either low velocity or a high velocity, and many soft tissues could get injured in the bargain. Imagine holding a lollipop at the tip of its handle and trying to swing the lollipop. There is minimal movement at the junction at where you hold it, but there is a hell of a lot of motion at the head of the lollipop. The similar thing happens when there are deceleration and acceleration forces compared to the head, the torso and the neck, and this is responsible for flexion and hyperextension kind of injuries. The cervical spine is most commonly involved because of lack of protection. 65% of the time there is a flexion compression mechanism which leads to fracture dislocation of the vertebrae. 30% of the time there could be an extension compression which leads to fracture of the facets. So just by looking at the fracture mechanism, one can realize whether it was a flexion or an extension injury. Injury to the thoracic and lumbar spine is usually by a compressive mechanism. The whiplash injury is ideally seen during a rear end impact, where it can involve the muscular ligamentous sprain, and this is combined with injury to the cervical nerve roots or the spinal cord. If one would assess the mortality by the injuries, the mortality of adults is higher than children if both sustain the same injuries. If one would assess the mortality by basis of the mechanism, the mortality for children is higher with the same mechanism of injuries. Children sustain more of brain injuries than thoracic or pelvic injuries. Children have more bony compliance. Therefore, even though there is a fracture, there is a very less sign of external injury. So one should always suspect pulmonary contusions when there are rib fractures. Spinal cord injuries are very rare, and the cervical spine is most affected in children. Children have very lax ligaments, large heads, poor musculatures, and here, although there is a fracture, there could be a transient vertebral displacement and realignment. Thus, it could completely injure the spinal cord, but when one does a CT scan, everything looks normal. So this was a very old term, that is spinal cord injury without radiological abnormality. But nowadays, with the presence of MRI, when one does a scan, you realize that the spinal cord has been damaged, whereas there is very minimal injury to the bones. Obese children are likely to sustain more injuries because the body weight has lesser amount of muscle, thus permitting more laxity of the bones and joints. In the pregnant population, the most common cause of fetal death is abruption of the placenta due to a shear strain force. Regarding the geriatric population, traumatic death is the fifth leading cause of mortality of persons more than 65 years of age. The common mechanisms are falls, fires, and vehicular trauma. For the same kind of injuries, the mortality is 5 to 10 times higher in the elderly. As many as 90% of patients never return to their previous level of independence, and the propensity of fracture increases due to a loss of bone density with aging, and falls account for 50% of the geriatric trauma. Blast injuries cause damage by 5 mechanisms. The primary mechanism is the blast wave. The air-filled organs are most susceptible, such as the lung and the bowel. Secondary injuries are caused because of the bomb fragments or the environmental fragments getting onto the victim. Tertiary injuries occur when the victim gets accelerated and sudden decelerated on a stationary object. Quaternary injuries occur due to explosive products with heat and toxins. And quinary injuries occur because of post-detonation environmental contaminants such as bacteria or the radioactive decay. Thanks for watching. Like, comment, subscribe, email me.